What is the transition like from school to adult services? We are getting into that today on the Autism Outreach Podcast. I had a wonderful conversation with Dr. Amanda Cash. She presented at the National Autism Conference this past August in Pennsylvania. I did not get to hear her talk, but I saw that she did this talk and I was like, I need to meet you. I need you to come onto the podcast. I feel like working with older learners, there's not a lot of good information out there. And this is a really wonderful podcast about what do school services look like for older learners? What does that transition look like for adult services? And how can we help to make that transition a little bit smoother? Dr. Amanda Cash has her PhD in applied behavior analysis from the Chicago School, where she is an adjunct professor. She currently lives in Virginia, where she provides training and technical assistance to schools. She has worked as a teacher as well. So she has a really great perspective on the clinical side of things and the school side of things, and just some real world techniques that we can use to help our students in that transition time and to help our students increase their ability to self-advocate. Enjoy this conversation with Dr. Amanda Cash.
You're listening to Autism Outreach Podcast, a podcast full of ready-to-use strategies to help those with autism strengthen their communication skills. Here's your host, Rose Griffin of ABA Speech, a speech therapist and board-certified behavior analyst who shares tips you can use in your next therapy session.
Welcome to the show. We have a wonderful guest for you today, Dr. Amanda Cash. Thank you so much for coming on the show. It's great to have you.
Thank you for having me. I'm excited to be here.
And I didn't even see you present, but I know the topic is going to be great. I had the absolute honor of being invited to present at NAC this past August. It's funny because I was talking to one of my really good friends, and I was on this whole thing last year where I really wanted to present at a lot of in-person conferences. And so last year I presented 11 conferences, and I was like, oh, I want to put in a proposal for, NAC, which is this really cool conference, takes place in Pennsylvania. And my friend was like, yeah, that's not how that conference works. You actually have to get invited. And I was like, oh, I didn't even know that, and then funny enough, somebody had emailed me like in January or some really early time. And I was like asking my friend, like, did you tell them about me? And they were like, no, we didn't say a word. So I think somebody had seen me present somewhere else or something. But it all kind of came together, and wow, what a cool conference. It's just like they bring in the best people. It was like a reunion of sorts for me and a lot of colleagues. So that's a nice little conference, isn't it?
Absolutely. Absolutely. NAC is an integral part to my development as a behavior analyst for sure.
Yeah, it's really cool if you're a BCBA and you haven't been to it. It is, what is it, Harrisburg? Is that the name of the city?
It was in Harrisburg last year, yes.
Yes.
To that, it had been at Penn State.
Right. So for me, it was like a 5-hour drive from Ohio, which is great. Like, I don't mind driving that far. It was like really nice, but it's a very cool conference. And they just bring in like really amazing people to present that you've probably seen doing a lot of different conferences. And it's like this really cool combination of people. So if you have a chance, hit up the conference. But as I was going through NAC, I was like, oh, I really want to meet you and have you on to talk about this topic, because I feel like we're going to talk about adult services and adult settings, which is near and dear to my heart. I worked as a SLP in a public school for 10 years at the middle school, high school level. And I just love that age group. And I feel like it doesn't get enough discussion and dissemination. So I'm excited that you're here. But before we get into all that, tell me a little bit about you and just kind of your journey into the field. How did you know you wanted to be a BCBA? How did you know that you wanted to go on to be a PhD? That's a lot of schooling. So tell us all about that.
Sure. So I actually started out in special education, and that was kind of by luck too. My undergraduate degree was in theater, and I graduated and tried to figure out what to do next. And so I got a job at a wilderness therapy program for students as a teacher based on some of my other previous experience, and then got to go back to school for special ed. And from there, I was just hooked. And I was lucky enough that I started out working with high schoolers. And my master's was in secondary special ed. So from the very beginning, I was focused on that older audience, learning about transition planning, really learning about the importance of thinking about the future and what came next. So from there, I went through some different teaching positions in special education, primarily at the secondary level, started working more with students with autism, both in public and private school settings. And then actually, you bring up NAC, learning about some of the supports that Pennsylvania's Autism Initiative was providing, I transitioned to the public school setting there and really got to learn from a lot of the behavior analysts that were providing consultation there. And that's when I went back to studying behavior analysis, really got into that and was kind of like, how come I didn't learn all this stuff as a teacher?
Right.
And so stayed in the classroom, continued to learn that stuff and just wanted to continue my studies through the doctoral level there. And then I moved to Virginia a couple of years ago, which was a big professional transition for me. And I was fortunate enough to get hired by Dr. Zach Bird to work for his company, Principal Behavior Consultants, in adult service settings, which was new to me. I had not worked in the adult settings in the past, and I was lucky to be able to, receive some mentorship and really learn that process. And what I saw was that some of the things I thought I knew about adult services were different than I had expected when I was teaching at the high school level. And I was just, it was important to me to then kind of bring this knowledge back to school services, because I think it's so critical to start those school development skills earlier, or those adult development skills earlier rather, and start to really bring that backward. So now I've transitioned back into providing training and technical assistance at the school level here in Virginia. But I am so enthusiastic about being able to stay focused on transition and to bring that experience of learning more about those adult settings as well.
Oh, I love that. That's very interesting. I'm taking it back like 5 minutes ago when you said that you had an undergraduate degree in theater, though, because so I did 2 talks at NAC, and one was a panel, and then one was a solo talk, and I like to do what do we call it as BCBA? Active student engagement. That's what a lot of BCBAs call it. So, and it's just fun for me. Like I like to have the Oprah Winfrey mic. That's what I call it. So I can go into the audience and I asked a question and I was talking about modified leisure and I went out into the crowd and somebody gave me like a very great like ABA type. It was like a really great answer. And so then afterwards, this person came up and talked to me. I've had him on. I just wonder if you know him because I think his undergrad was going to be or was in theater is Rob Harvey. I don't know if do you know who that is? Oh, you don't. Because I think, lives in Pennsylvania and always goes to NAC, but he was on, and he came up to me afterwards. We had a nice little conversation. He mentioned he had been on Matt Sikoria's, who I'm kind of friends with, Behavioral Observations podcast, and he talks about using Dungeons and Dragons to work on social skills. And I was like, I need to find out who this guy is. So anyway, he came on to the show, but I know you can't see it now, but I used to play the harp. So I played the harp for like 20 years for gigs and stuff. But when he was on the show, it was interesting because he talked about how like when you're doing a therapy session or even when you're training staff, right, or going into the school, it's like some part of that is like performative is the word that he used, which I liked because it's kind of like, we talked about soft skills earlier today with a different guest, and it's like you can convey information in one way, but it is kind of performative, right? Like staff training, parent training. And it's interesting that that's your background because do you think that some of those skills are helping you in your role now?
I definitely think some of those skills are helpful. And I even thinking about like character analysis and watching people and starting to think about the theater aspects of developing characters is very similar to starting to think about things like motivation and what's going on in an environment and those interactions as well.
Yeah. Yeah, I love that. That's so interesting. So we're going to talk about how we can support success in the adult services setting. Can you share with listeners some differences between school and adult settings? I think that's important to kind of get that baseline set.
Absolutely. So one of the first things that stood out to me in the adult setting was the differences in time and the pace of the day. So in the school setting, I was used to a very fast-paced schedule, transitioning between activities pretty frequently. And then in the adult service setting, I noticed that things slow down pretty significantly. And obviously, when we say adult services, there's a whole continuum of different things that could encompass. Mm-hmm. So here I was working more in like a group home setting, day support settings, those types of settings where the days suddenly seemed a lot longer and slower paced than they did in the school setting. So that was a big adjustment when you're thinking about activities that are going to occur. The other big difference with that was to think about time over years, right? In school, we're counting down until graduation. And by counting down, I mean there's this imminent pressure of we need to get as much as we possibly can in. And then yet when we think about how long the rest of one's life is, it's very long. And so we want to make sure to be able to make that as meaningful and significant for the individuals as possible. Another difference, I think, is thinking about some of the staff training and focus. So in schools, we're really focused on learning and teaching. And although in adult service settings, there's still, active treatment programs, a lot of the shift traditionally has been more towards that caregiver role, really wanting individuals to be happy, to be safe, but perhaps not working as much towards those skill development goals as we would have in the school settings. And that really emphasized for me, again, that importance of teaching as much as possible in that school setting where we have that more intense environment for skill development. And then finally, thinking about issues around choice, restriction, human rights, those things are different in the adult setting. And I think, we're evolving practices across ABA when we think about assent-based treatments and really involving our learners from the beginning and trying to involve their preferences in treatments. But especially at the adult level, we need to make sure to consider all of those factors and to keep in mind learning what the human rights regulations are where you're working, involving human rights activists to make sure that you're staying aligned with those, and then involving your individual and their caregivers throughout the whole process to make sure that we're honoring and respecting our individuals throughout treatment and making sure to lean in on their preferences while also knowing that some issues around restriction, especially when it comes to potentially withholding different reinforcers, contingent on certain behaviors, looks different in the adult setting. And there might be rules around that you're trying to navigate and that you really need to learn about those things.
Yeah, it's a lot to take in. And I think that's a good idea. Yeah, the differences in pace. I know when I was working, it's interesting for me because in the district I worked in, most of our kids did stay in the school district until I think the age of 22. It is, we would start the transition. I can't remember if it's a United States law or Ohio, but at 14, you have to start talking about transition. You check that part on the IEP, but I was in a really wonderful district. So we had a transition coordinator. We had this amazing vocational setting where our students would get an assessment their freshman year, and then sometimes their sophomore year, they would do a half day here and a half day at the vocational place. I would go out and see them in the work setting. I loved working with older students because it felt really functional. It wasn't like I do like working with little kids too, but when you work with little kids, it's like, here's my bag of things, like I was just I have a membership called the ABA Speech Connection. I was talking to somebody who goes into homes and provides early intervention, and they're like, the kids want to get in my bag. But when you're working with adults, it's so different, right? You don't usually need like all the things, it's just, it's a very different thing. And thinking about transition, I always thought it was really fascinating just to learn about like those meetings when the students start to get older, all the different people that are involved in adult services. There's like just all these different agencies, and like it's I'm like, wow, these are a lot of people that I don't know that are not from the school district, But I think I was really lucky in the fact that the district I worked in was just a really great district. I mean, we just really provided, I always said it was the Bentley of public school districts because we had 4 speech therapists and 2 of us were duly certified as speech therapists and BCBAs, which is wild. But it still was not, sometimes it wasn't good enough, but that's a whole other show. But I know that not every district is like that some are still really trying to get a handle on what these systems should look like in treatment services for the students. So, but one of the things I know is so important is self-advocacy. And I talk about that a lot, would always set goals for that for students. I make a lot of short form video content on Instagram and LinkedIn. And some of my most popular videos are about self-advocacy goals for students, which I think, oftentimes need to be directly taught. So what are some self-advocacy skills that are important for older learners?
Absolutely. And I think that, you alluded there to starting transition planning earlier. And I think that ties into this question too, that we need to start teaching these self-advocacy skills earlier so that we are able to build up stronger skills, a greater variety of skills as our learners develop. And so starting with some of those basic manning for preferred items, activities, interactions, trying to keep those and build this repertoire of specific mans so that they're able to request the things that they really like. Well, in addition, then continuing up that continuum of man skills so that we're teaching things like asking for the missing items when you go to brush your teeth and there's no toothpaste there, or asking for help and attention from other individuals to attend to you. Those are all really important skills, especially because while in a school setting, many individuals have one-to-ones who are right there to honor their requests and meet their needs. In the adult service setting, the ratios might be different.
Right.
And so really initiating in order to be able to advocate for yourself becomes even more important, because now you might first have to get that attention of the individual. Also, making sure to teach requests to get out of situations, teaching individuals how to ask to leave or say that they're all done with a situation to escape those aversive situations is critical, because we want to be able to provide those choices so that they have them throughout their life to be able to express their wants and needs.
Yeah.
And I think
it's really
sorry,
empowering.
Go ahead.
No, it's just empowering for people to, I've just been working with that type of learner who is really an emerging communicator across, I've worked in public schools, but I also spent a lot of time working in non-public programs until I started my own business. And you would meet older students, right, who are engaging in very unsafe, severe problem behavior. And it's not a surprise that there's a communication deficit, right? Like they haven't, like then they're getting sent to this private specialized program to try to learn these things that you're talking about. Because, I've met kids that were 18 and didn't have a response form, didn't have a way to communicate. And you can see how problematic that is, right? And I think that's the thing too that's really hard for parents sometimes. And I don't know if it's like, okay, this is an academic track, this is a vocational track. Like sometimes schools will use those types of words, but we know that we want a kid to be able to ask for a break when they need a break. Like that's a great lifelong skill, right? We don't want somebody to like throw something or hurt themselves or hurt others in order to access that break. And I think sometimes it's really hard for people to understand that needs to be an actual goal on the IEP document, right? And we need a lot of spend a lot of time working on that.
Absolutely. And teaching those like choice making skills and really thinking about backup forms of communication too, especially if we're starting to work with learners that are, taking some sort of assistive technology into their adult setting and needing to figure out what's going to happen or what are they going to do if the battery dies, like teaching all this component skills that go with those things to be able to make sure that they're able to communicate no matter what. And I think another important self-advocacy area where students can practice is in those IEP meetings that you were just talking about. So I was fortunate that even in my master's program, we talked about involving students in the IEPs right up to student-led IEPs, so that even if they were only able to share things like their strengths or their needs, starting to teach learners early on to be involved in that. And you think that can be an intimidating setting, but it's a great opportunity for students to practice those self-advocacy skills.
Yeah, I actually attended, I think it was the only talk I attended that I didn't give at NAC because, well, no, I went to a couple other ones, 3, but one I went, that was not by some people, I didn't know these people, it just was like, oh, this looks like a really great topic. It was student-led IEPs, and it was really great. Like I did that, even when I was working at public school, one time I was working in a public school, but it was like a consortium of all these other smaller districts here in Ohio. It was really specialized, and we had a focus on including students in the IEP process. And I really love that. And I definitely, like when I was working in middle school, high school, even for like, I had a couple kids who stuttered, and I was like, okay, like I want you to come to the IEP. Like this is about you, and it's for you, right? Not about us, without us, that kind of advocacy rule. And I always thought that was really empowering, because I always make sure every single kid that comes through my therapy door understands on whatever level they can understand, like why they're there, why I'm there to support them. I feel like every kid should really kind of know what their IEP goals are. But I love that idea of just talking about that again, like a student, either student-led IEP or a student being a part of the IEP process. Have you found that to be really powerful practice?
I have found that to be really powerful. And I think one of the things that first stood out to me is in my graduate program, I saw a video of a student who communicated with a head switch interject into their own IEP meeting.
Yeah, I like that.
So to me, that was just indicative that this was important for all students, regardless of their communication skills, that they should be involved and that they still could participate in some way.
Yeah, and I like that. I think that even too would empower parents, because I think sometimes parents don't realize all the things that their kids can do, that it's like open to them, that they could do something like that. Even a learner that maybe really has high support needs in the area of communication, to have them do something like that. And it would just be empowering. I do a lot of consulting work, and I've do some teletherapy. And I know, like, maybe a couple months ago, I was like, okay, we're going to do like modified Connect 4. And I'm like showing a video model, from my YouTube. And I think before we did all that, the person that was the facilitator, the one-on-one behavior therapist, was like, oh, they can't play that game. They can't do that. And I was just like, channeling my inner Pilates calm. But then I just, didn't say anything mean. I was like, oh, let's try it. We watched the video model, we did it. And then they were like, wow, that went great. Like I can't believe they could do that kind of turn taking activity. So I decided to make that a teachable moment, and instead of like, getting upset about it. But I think sometimes when we include students like that, it has like this effect that we don't even know about, like well beyond, right? Because you remember that video of that kid, right? And we're using a head pointer, right? Which is something you don't get to see that often. And it stuck with you. Oh, I love that. That's cool. So what can we do while individuals are in school to help them prepare for the transition to adult services?
So I think the main thing that we can do is really focus on teaching as many skills as well as possible in the amount of time that we have. And then to make sure that we're having these conversations about transition early and often, so that we're really backwards planning those instructional design and making sure that we're setting those goals that we want the learner to work towards as their post-secondary goals. And within that, making sure that we're focusing on instructional practices. You mentioned different placements that can occur in special education. And I think one of the things to keep in mind, regardless of the placement, is need for intensity of instruction. So if we know that a learner is takes a high number of trials to learn new skills, then that it's even more important to start that teaching early and to really prioritize the skills that are going to be most important to their life once they graduate. And so figuring out how we're going to integrate that in and do it in ways that are going to generalize to their natural setting is important too.
Mm-hmm. That's really important, that generalization piece. And I think, so let me ask you one other question so with adult services, because actually I don't know the answer to this. I thought that it was maybe, you said like, some people will be listening and be like, oh, it's hard for me to get a one-on-one for a kid who actually needs a one-on-one, right? In a public school, sometimes that's hard. But in a adult setting, is it more like 1 to 6, or do you think it's even more? Like, I know that every single place is going to be different. I don't know if does every adult setting have their own guidelines, or do each state have a guideline? If you don't know, that's okay. I'm just curious. I always thought it was like maybe 1 to 6 or 1 to 12, or I don't even know.
I'm sure it varies from setting to setting. In like the day support type settings, I did see ratios similar to what you were talking about, like around that 1 to 6 ratio.
Right.
And I think another thing that I heard in some of those settings was in the affects instruction is considering under what context behavior should occur. So for example, I think of shared bathrooms, right?
Right.
So it might be that a learner learns they clean up the bathroom when you tell them to clean up the bathroom.
Mm-hmm.
But then in like a group home setting, perhaps the staff don't want to always have to tell you to clean up the bathroom. So the more that we can connect that teaching to what is the trigger for that behavior in the natural setting, what is the SD that they should be responding to? And then how are we also connecting that to those natural reinforcers? That's going to be so important in those more naturalistic settings where ratios are different and where some of those more expected behaviors are just going to mean a lot to your housemates, to the people in day support with you, and just help build the quality of life for everyone that is there.
Yeah. That's why I think it's so important. I do a lot of ACE courses and ASHA courses for speech therapists and BCBAs. And the one thing that, makes a lot of sense to me, and I know, is that when our teaching setting looks more like the natural environment, obviously we're going to generalize, our skills easier. And so that's why for me, I always really liked working with older students, because I was like, if a kid was in high school, even sometimes middle school, I was really doing therapy. I always put in my IEP goals the larger school environment. So, okay, well, this kid needs to follow one-step directions. Well, let's have him walk to the free library in the school and pick a book that he likes that I have planted there, like because it's a kid who likes board books or, something like that. You have to really be, what I had found working at that level is be a detective of the building, understand how the building works, make friendly with the principal, make friendly with the custodians. I had kids doing all different types of vocational tasks because I remember one time I got into like a disagreement with a psychology intern because she wanted me, a kid who was in resource support getting very minimal speech therapy services, she wanted me to pull him into my office to work on two-step contrived directions. And I was like, oh dear, this is all wrong. And I'm sorry, but I'm arguing this point, to your point of like, it needs to generalize. We need to think about like, when is this kid really or adult going to be able to utilize this skill? And that generalization piece is so huge to think about while we're teaching it, right?
Absolutely. And that's why I think we have to look for things like how can we contrive those opportunities in the school setting and then even beyond the school setting. The more skills we can teach to, the more opportunities we open up for individuals, whether it's moving towards then other types of post-secondary training or employment opportunities, really those meaningful work opportunities. But that's going to take getting out into the community, getting onto workplaces and being able to practice those skills while they're still in school too, and not waiting until that transition time when they're out of school services so that they're able to develop those skills and then take them into that next step so we have more meaningful opportunities for them in adulthood.
Yeah, I love that. That's important. And that's why, like the with the ratio thing one more time, that's a big jump, I think, for parents and probably for the adults that are transitioning. I always tried to focus on we used to set goals for independent leisure skills because some kids it's hard for them to have an activity that they love and enjoy and that they can do during a downtime because like you said, the pace is different. And it's like you need to know what to do during your downtime. And if you don't have that, that's really a skill that's lacking that potentially you could have a goal for because like you said, the pace is different. You might do an activity and transition to something different or make a choice, but there is going to be downtime and that's just part of being a human. And you have to have something right that you are going to enjoy during that time. So that might be something to think about too for listeners. So
I will say like that was definitely one of those eye-opening moments for me in adult settings was I wished I had prioritized some of those leisure skills more in the classroom because although they might offer an activity, if the individual chooses not to participate in that activity and also doesn't have those independent leisure skills, now you just have that time sitting around, which just isn't that meaningful use of an individual's time during their life that we want to try to maximize.
Yeah, I love that. That's cool. Well, thank you so much for coming onto the show. It was really wonderful to connect. Great information.
Well, thank you.
Thanks for listening to Autism Outreach. If you enjoyed the show today, make sure to subscribe so you don't miss an episode full of actionable strategies you can use in your therapy room. Write a review too. That would mean so much to me. I always love hearing from you. Have a specific topic that you want included on a future show? Reach out over on Instagram, ABA Speech by Rose, or visit me at www.abaspeech.org.